Oh, I was talking to myself. Hey, Joy. Okay, so with the pharmacology, looking at the drugs that work on the autonomous nervous system, okay, that is the autonomous nerve. So we have the parasympathetic system, we have the direct acting and the indirect acting. So locapan is a direct acting one, phosphorylin is an indirect acting. Okay, because it rather inhibits the cholinesterase. Okay, and then we have the parasympathetic, that is a antagonist the parasympathetic system. That is atropine, yeah, atropine. And then we have the sympathetic drugs also, and the sympatholytics. So for the purpose of studies, uh, I think some of the common ones that we have around for the sympathetics, I think you should be able to, talk about atropine, mention its actions, what we use it for clinically, and adrenaline is also a very common drug that we find around. So you should also be able to talk about adrenaline comfortably. So just go read. And which one again? Which one again? Yeah. Uh, yes, so I think those are the two main. And then also, okay, there's sympatholytics. So timolol, atropine, and adrenaline. You need to write some short notes on them. Yeah. Pilocarpine, so these four. So you should be able to write short notes on them. The other, yeah, so that's about the pharmacology. And okay, so this one I've already given slides on this includes refractory error. Pharmacology. I mean, you could be asked to write on some of these drugs, and of course, you should try and understand glaucoma a bit more. And what again? Yeah, of course, and also common things are always common. So if you put your mind to it, you know some of the most common conditions that we experience or that we have with our eyes. So that's why you don't need to be told. You should know those ones. And then, I mean, if someone presents you with some of these common eye condition, I mean, the most common eye condition that you see in the clinic, I'm sure you should be able to manage that one. So study that one also very well. So basically that. So that's what I wanted to say about the PDF notes. But I'm going to send you the PowerPoint for last year shortly. So
Okay, Doc.
the other things I was saying was that because, for example, the mistakes I've seen here, and I'm having to redo the notes for you. That's why I said I thought that we can have the exam tomorrow. So we should look for some time next week, preferably towards the weekend, maybe Friday, Saturday. Those days they should be okay. So let's see how we go about it.
Okay, Doc.
So you discuss with your class reps and get it to me. I hope you received all the notes that I've sent. Class people, have you received the notes or your class reps are holding the notes?
We have received it.
Okay. All right. So the exam shouldn't be difficult.
Doc,
Just that if
is it You said you talk about the scope of the ophthalmology when you are done.
But what did I do? That's just what I just did right now.
Hey,
Oh,
Okay,
you're not listening. Yeah, so people are sleeping, just waiting to hear. Okay,
oh,
but I said
This
it.
one was broad scope.
oh no, sir, you said, oh, if they are objectives. And you say, if you are written, so which was
So it's 20 best answer questions. All right, choose one. Then the section B is answer all. You write short notes. The pharmacology, that's what I've just mentioned. That those drugs, they can write short notes on them, looking at the class of the drug. If you actually write short notes, I mean, you look at the class of the drug, the effects or the mechanism of action, maybe the side effects and clinical use. Yes. So those common drugs, the timolol, the flucapine, the atropine, and all that. So you should be able to write short notes on them. You should be able to, diagnose and treat glaucoma. I mean, talking about risk factors and all those things that you mentioned. Um, I think I'll have to send you the PowerPoint to show the
okay,
problem
no.
setting up. Um, so if I give you the PowerPoint, okay, um, focus on that one more than the PDF notes. The PDF notes are written on things as well. I get me.
All
So
right,
I'm
doc.
going to send you the old PowerPoint slides. So if unless the pharmacology, I don't think there's a PowerPoint for it. So the pharmacology you can use the PDF notes, but the rest that I'll send to you as PowerPoint, focus on the PowerPoint more than exactly.
All right, doc.
yes, doc.
Yeah. And yeah, so that's what I've said. And then the most common eye condition, that one is up to you to decide what the most common eye condition that you see is. It will come. So just be prepared for this. Mm.
Hmm. Doc, please, how many questions for the section B?
Section B, be either two or three questions, but they always have A, B, C, D, I, K, I, C, I.
Yep.
Hey, Dr. Kazu.
Oh, that's right.
Hey.
So, sir, there will be nothing like maybe clinical scenarios and all that.
All my questions are clinical scenarios. Most of them are clinical scenarios. But if you understand the question, all I'm talking about it is broad. So,
Okay,
mm,
doc.
so that's what I'm saying. So, for instance, instead of telling you that this is a refractory error, I could pose a question that Kweku is unable to see from a distance of about 1,000 meters away. What is your impression based on this history? A. B. What investigation would you do to confirm your diagnosis? C. List or describe how you go about treating this condition. And that is how I would ask a question of refractory error. I wouldn't say this better as refractory. Do you get my point?
Yes, doc.
Yes, doc.
So that's how the clinical questions come in. So something like glaucoma, you should be able to know how a glaucoma presents, for you to be able to make a diagnosis. So that, for instance, if you don't know there's visual field loss, and how does visual field loss appear? By the way, who can tell me how do people with visual field loss present? Hmm? Yes. Let me see if I'll find it for you. Okay. So something. So what you need to also remember that glaucoma. Anyway, when you read a note, you see. So it's usually asymptomatic until it's far advanced. So see, someone who has what do you call it? Who has visual field impairment. The slides will contain more pictures for you to understand it better. I couldn't put any pictures in this one. And so because of the visual field loss, the person can be bumping. They can't see certain aspects of their sides. And so they are walking the streets and they are bumping into people all along the way. So you should know some of these petty things. to be able to make a diagnosis of glaucoma. Yeah. As for the most common eye condition there, I won't even talk about it. If you don't know that one, that one I don't. So at this juncture, one may ask, any other question? Okay, so I can see that everybody is fine now. So we'll find a date and then let me hear from you. Let's get this over and done.
All right,
All
Doc.
right?
All right, Doc.
Okay.
We'll do
So
so.
running for the slides, I'll send them shortly.
All right, Doc. Thank you very much.
All right. Right.
Ese no get any problem. Ese make look for it.